A row here along Toronto's University Avenue is the heartbeat of Ontario's medical system. Across the province, hospitals like these are in crisis as this wave of the pandemic rolls on. So how did we get here? And what can we do to fortify our healthcare system in the months and years ahead?
We're doing hallway medicine, and the whole effort right now is to make sure we don't end up in parking lot medicine with people flowing out of the hospitals.
A reality check from emergency room doctor Kashif Prasada.
Let's say I work at a hospital in Brampton. That place was built for half of the population that it's servicing now. And you can tell because there's just no room to admit people.
This graph shows that not just Ontario, but Canada as a whole is trailing many other developed nations when it comes to hospital beds per 1,000 citizens.
When times are bad, as they are currently, there's really proof in terms of how our policies are working. And what we're seeing is absolutely failed policy. Again, not just from the provincial government, certainly not helped by this government, also from past governments as well as the federal government.
Today, the leader of Ontario's Liberals took part in an emergency hospital summit with NDP and Green Party officials.
The Liberal Party of Ontario had decades to improve capacity. Do you believe, that your party bears some of the responsibility for where we find ourselves today?
This is a challenge that's about 20 or 30 years in the making, cuts across governments from virtually every political stripe, if not every political stripe, over the past number of decades, because there's been an emphasis on this notion of efficiency rather than on resilience.
They say you should never waste a crisis. I do think it is a good opportunity for us in Canada to look at our healthcare system and how we do things overall.
The chair of Canadian Doctors for Medicare believes there's efficiencies that can still be created in the system that don't involve cutting healthcare funding.
If you are referred to a surgeon, oftentimes your family physician or the referring provider will refer you to a surgeon that they're familiar with. It won't necessarily be the surgeon with the wait list. So having a centralized list where you are put into a certain pool and then are assigned to the surgeon or healthcare provider with the shortest wait list can significantly shorten wait times.
With hospitals across the province already at capacity, the debate between a private and public healthcare system has begun once again.
We have a limited supply of healthcare providers in Canada. We have a limited number of working hours. If you take staff who are currently working in the public system to work in a private pay system, you're probably going to make the wait times longer for the vast majority of the population.
One thing many critics and healthcare experts say cannot happen is further cuts to healthcare. Here in Ontario, prior to the pandemic, the Ford government was moving to slash the budgets of multiple public health units. Those cuts have since been put on hold. I'm Adrian Ghobrial for City News.